Hello everyone, I'm Dr. Irfana Patil, Consultant Cosmetic Dermatologist, Forever Young Skin Clinic, Kolhapur. Today we are going to discuss about Palmoplantar Hyperhidrosis. Now this is a very common condition. So basically what it means, Palmoplantar Hyperhidrosis means excessive sweating of the palms and the soles. So most of the time it runs in the family and there is a very strong genetic predisposition for this condition, and many a time it is idiopathic, that is there is no specific cause for it, although sometimes it may be related to underlying stress, anxiety or hyperthyroidism, but most of the times it is idiopathic. Now we have the eccrine glands or the sweat glands distributed all over our body surface, but in few specific areas there are more number of eccrine glands, like the palms, the soles, the underarms or the groin area. Now many a times it happens that under stress and anxiety there will be increased sweating. So in palmoplantar hyperhidrosis, under normal condition also there will be too much or excessive sweating of the palms and the soles, and of course during stress and anxiety the sweating will increase, and this can be very socially and professionally very disturbing for the patient. Now for this condition there are various treatment options are available, and logical approach has to be taken up to treat this condition depending on the degree of the functional impairment. Now there are various topical formulas or topical applications available to treat palmoplantar hyperhidrosis. Then there are procedures like iontophoresis or botulinum toxin injections. Then there are systemic medications or anticholinergic agents, and the last resort is of course surgical. Now topical applications like aluminum chloride hexahydrate 10 or 20% solutions are available. Now it's a tedious procedure here. You have to apply this daily, keep it for an hour, see if your skin tolerates it, then you apply it, keep it overnight, and then once you start noticing that it has started working, then you can taper the dosages and keep a maintenance of it. Apart from aluminum chloride hexahydrate, there are other molecules also like boric acid, formaldehyde, potassium permanganate, anticholinergic agents, tannic acid, resorcinol, which are also used and tried. But there are some concerns about the topical application. Sometimes it can cause irritation, it can cause irritant dermatitis, and it is not that feasible to apply daily and then keep a maintenance of it. There are many systemic agents like the anticholinergic agents which can be used to treat palmoplantar hyperhidrosis based on the action that acetylcholine is the neurotransmitter from the sympathetic innervation of the sweat glands. But it can have many systemic side effects like dryness of the mouth or constipation, and many other side effects can happen because of it. Now procedures like iontophoresis, these are the very old and established therapy for palmoplantar hyperhidrosis. Basically it is very cheap, inexpensive method, and it is nothing but passing of a DC current through the skin, which will create an electrochemical gradient and it will reduce the sweating from the sweat glands. But the problem with this treatment is it has to be done almost daily or alternate days till we get the results, and then it has to be maintained for once or twice a week, and each session it takes at least half an hour. So it is difficult for the patient to spare so much time for this treatment. So currently out of these treatments, injections of botulinum toxin or Botox, which we commonly know of, is the best treatment option available because it is time saving. Of course it is a bit expensive, and it also lasts longer and very easy. Injections of botulinum toxin are safe and effective, and it improves the quality of life of the patient to a very great extent. Normally we inject multiple points 1.5 to 2 centimeter apart, and after application of a numbing agent or a topical anesthetic, they are good for a long-term relief. So the botulinum toxin injections are given into the skin, and there are multiple injection points, and you start seeing the results within a week, and the action lasts somewhere between 4 to 6 months. And when you repeat those injections, then the result will last longer. So sometimes there can be a slight or transient weakness you can notice after the botulinum toxin injection, and that's the only potential side effect which may happen, and sometimes very rarely there can be some bruising which may happen. So botulinum toxin injections are very safe and effective way for long-term relief from your problem of palmoplantar hyperhidrosis, which can be very psychologically, emotionally and professionally very disturbing for you. So for more information about this treatment, you can definitely get in touch with us. The contact number is mentioned in the description. And if you have liked the video and found the information useful, do share it with your friends and subscribe to my channel for more updates on skin and hair care. Thank you.